Hello Indian foreign medical aspirants, welcome to my YouTube channel. Advisory for Indian students issued by the Embassy of India, Beijing, China. Hello medical students, welcome to my YouTube channel. Here is an update from the Embassy of India in Beijing, China. Some of the parents and students have asked the embassy regarding certain queries in the admission of prospective students in China. The embassy, while clarifying the various queries raised by them, clearly advised in the form of a frequently asked questions what are all their doubts in the matter of admission in Chinese universities, their language problem, mandatory learning of Mandarin language in China, and the list of 45 authorized universities that offers medical program in English language. There are certain universities that offers medicine in Chinese language also, in which these students are advised not to take any admission there. Such important informations are clarified, and this information is available in the official website of the Embassy of India in Beijing. This clarification was issued last Friday for the benefit of aspiring prospective students. Let we have the question and answer one by one. Embassy of India in Beijing has been receiving several queries from prospective Indian students and their parents with respect to seeking admission for undergraduate clinical medicine program in China. Since several queries have been received in this regard, an advisory in the form of question and answer is below for information of all concerned. First question: what is the duration of a medical doctor degree or MBBS in China for foreign students? China offers undergraduate program in clinical medicine, which is of 5-year duration plus 1-year internship. However, the exact length varies from university to university, which can be checked from the respective university's website. Question 2. Which are the universities in China where foreign students can enroll for clinical medicine undergraduate program? Ministry of China has issued an official communication wherein they have shared the list of 45 universities in China that are authorized to give admission to foreign students to undertake clinic medicine undergraduate program course in English language in China for the year 2019. Prospective students are advised to note carefully that only these 45 Chinese universities are authorized to admit international students for the clinical medicine undergraduate degree in English. A list of 45 universities can be accessed from the website. Third question: can foreign student joins for clinical medicine program in Chinese language? Ministry of Education has clearly mentioned in their official communication that foreign students can only join medical program in 45 universities in English language. They cannot join for studying clinical medicine program in China, which is offered in Chinese language. They have also clearly stated that any university offering clinical medicine program in bilingual mode, English and Chinese language, is strictly forbidden. How much does it cost to study MBBS in China? How can I get the details of fee? The fee structure is different from university to university. Students are advised to check from the university directly before taking admission. Is it essential for an Indian student to learn Chinese during medical course in China? As per regulations, the courses are offered in English language. However, learning Chinese language is mandatory for clinical sessions. Hence, every student will also need to learn Chinese language up to HSK4 level. Any student who does not clear the minimum Chinese language skill will not be awarded degree. Prospective students are requested to check with the university concerned about this requirement beforehand, as there are minor differences on the level of Chinese language skill requirement for different universities. Next question. What is the provision and duration of internship for foreign students? After completing the degree course by provisional degree is awarded by the university, students are awarded final degree only after 1 year internship. Question number 7. Can an Indian student obtain a license to practice medicine in China, and is this at par with the registration granted to local citizens in China? If so, what is the complete process of registration in China? Is there a licensing examination in China for the purpose? In order to obtain license to practice medicine in China, foreigners must pass the qualification examination of doctors of People's Republic of China. The process is as follows. Complete the clinical medicine graduate program. Thereafter, complete the 1 year of continuous professional training internship from the affiliated hospital of the university concerned. After completion of internship, students have to clear Chinese medical qualification examination and obtain physician qualification certificate. Question number 8. Is obtaining a license to practice medicine in China mandatory to appear for FMGE in India? NMC regulations dated November 1821 state that any prospective student who seek medical education abroad after November 1821 should necessarily have license to practice in the country of graduate after completion of his/her clinical medicine program before he/she can appear for FMG examination in India. Is it mandatory to clear NEET UG examination before seeking admission in any Chinese university for clinical medicine program? This answer is already known. NEET is the prerequisite condition for enrollment in Chinese universities as per the regulations of the National Medical Commission. Without the NEET qualification, they will not be permitted to take up the foreign medical graduate examination after completing the course from abroad. What are the major issues to be kept in mind while planning to enroll in China for studies? This is an important question. Students who are planning to enroll in any university in China for clinical medicine undergraduate program are advised to ascertain themselves whether the university is in the list of 45 universities, the duration of the course as it varies university to university, curriculum being offered, language of instructions, mode of education, online or offline, fee structure, visa requirements, etc. before proceeding to China. Moreover, due to the dynamic zero COVID policy of China, there are various restrictions and quarantine norms in China, which varies from city to city and are very strict and demand full compliance without exception. Moreover, these regulations are updated regularly. Therefore, Indian students enrolled in Chinese universities are advised to take note of the latest regulation of the place of travel and make appropriate arrangements. How is the quality of clinical medicine undergraduate program in China? The embassy has received several feedback from the past students who have completed such a program earlier. One of the most common challenges is the English language skills of Chinese universities. Few students have also complained about lack of practical clinical experience in terms of engaging with the patients in certain universities. Prospective students and their parents may also wish to look at the study conducted by the National Medical Board of Examination of the pass percentage of students who had studied in various Chinese universities. The study shows that only 6,387 out of 40,417 students who appeared in the FMG examination from 15 to 21 have cleared it. Here the pass percentage of Indian studies who have studied clinical medicine program in China in that period in these 45 universities was also 16%. The prospective students and parents may please note this fact while deciding on seeking admission in Chinese universities for clinical medicine program. Then question number 12. There are reports that Indian students can take admission in universities which are not in the list of 45 universities of China. Can this be confirmed? Foreign students had taken admission in more than 45 Chinese universities for clinical medicine program earlier. However, as per the latest notification issued in 2019, the Chinese side has authorized only 45 universities to provide clinical medicine program to foreign students. Indian students are advised not to seek admission in universities other than the 45 listed by ministry, as you may face problem in getting the license to practice in China, thereby making you ineligible to appear for the FMG examination at a later stage. Last two questions. Out of the 45 universities, which are the universities recommended by the embassy for Indian students? The Chinese ministry has not published any separate ranking of various Chinese universities which offer clinical medicine program. However, as per the pass percentage of Indian students in the FMG examination, we have prepared a table of these 45 universities. Prospective students may wish to make their own judgment while making a decision to choose the university, as the embassy or the National Medical Council of India has not done any ranking or evaluation of the quality of education offered by these universities to foreign students. For the convenience of the Indian students, the contents of November 18 notification is also published in the web portal. For updates, subscribe to my YouTube channel. Thank you.